Hello everyone, my name is Dr. Seun. I am a chiropractor and a biomechanist, and I work a lot with injury prevention and rehabilitation. As a two-time Olympian, the first and only African to compete in both the Summer and Winter Olympic Games, I do have a lot of experience performing at the highest level of sport in not just one sport, but in two sports, in track and field and in the sport of bobsled. And one of the things that I'm able to do is integrate my actual experiences as a professional athlete into what I am finding in the data. I've been privileged to work with athletes from the high school level, the collegiate level, and the professional level in various different sports, including basketball, track and field, and football. So I wanted to talk a little bit about DorsaVi and my work as a biomechanist and some of the tools that I use when I'm doing biomechanics analysis. Now, DorsaVi is a muscle testing system that allows me to use different types of sensors to find out what the body is doing in space at any given time, depending on the activity that I'm asking the client or the athlete to perform. I love using this tool, especially as a pre-test for my professional athletes, my collegiate athletes, or my high school athletes to find out exactly where they are performing. In this, I'm able to identify some of the things that they are doing with imbalances, some of the muscles that are firing too fast or not firing enough. I'm also able to identify where they may be prone to injury. So why is this all important, and how do I continue to use this in a treatment program for the athletes? Well, with DorsaVi, what I do is I end up getting a breakdown of exactly what the athlete is doing when they perform certain exercises in the lower body and in the core. So this is especially effective for any athletes who do cutting sports, for any athletes who do stop and go sports, for any athletes who do jumping, and honestly for any athletes who have to come to an abrupt stop at any point in time. This is really important for the assessment of what the knee joint is doing, what the hip joint is doing, what the core muscles, the glute muscles are doing, and which muscles these athletes need to focus on in order to really maximize their performance.